we have is the anterior drawer test. You're gonna have your patient come off of the table with just their knees and down or hanging off the table. The examiner is going to crouch down into this position, one hand stabilizing the lower leg and the other gripping the calcaneus. Keep the lower leg stabilized, and with the other hand that is gripping the calcaneus, move it forwards and backwards. If they have a positive test, they have a fractured talus and or possibly a torn ATF. This test is the Thompson's test. You're gonna have your patient prone on the table and you are going to squeeze their calves. See how her foot is moving? I'll actually do it to this one so you can see it more. See how her foot is flexing? If her foot does not flex, this means that she has a torn or ruptured Achilles tendon. The next test we have is the inversion stress test. Please have your patient like this, just ankles off the table. One hand's gonna grip the leg, the other's gonna hold the calcaneus. Make sure your patient is nice and loose, and you're gonna chicken wing with your arm, not your wrist, your arm, and bring their foot inwards gently. If they're experiencing pain, this conducts that they have a positive test. So they have a torn CF, possibly ATF and PTF. The next test is the eversion stress test. Make sure your patient's ankles are just off the table. One hand's on the lower leg and the other hand's gonna be on the calcaneus. And again, you're gonna chicken wing their foot externally. If they have a positive test, this means they have injured their deltoid. Now we have the bump test. Make sure your patients, only their ankles are off the table. You're going to hold the ball of the foot with one hand, and with the other hand, you're gonna start very softly hitting their calcaneus, and you're gonna progressively hit it harder and harder. If they have a positive test, this means they could have a fractured fibula, talus, calcaneus, or tibia. The next test is the squeeze test. Just have your patient's ankles off the table. You're going to start at the knee and go down to the ankle, gradually pressing with both of your hands, like so.
If they have a positive test for this, they've either fractured their fibula or they have a torn ATIF/high ankle sprain.
Now the next test we have is external rotation test / Slick-Liger's test. You're gonna have your patient just have the knees in below off the table, and the examiner is gonna crouch down, and with one hand you're gonna hold the ball of the foot, and the other you're gonna stabilize right here with a high ankle / lower leg. Now what you're gonna do is you're gonna externally turn your patient's foot, and then you're gonna dorsiflex the patient's foot and externally rotate again. Now what could be hurt with this is the deltoid and a high ankle sprain / ATIF.